Now let's look at the causes of mental disorder from the cognitive perspective. This explanation is called the cognitive mediation hypothesis. According to this view, external environment life events, as well as dysfunctional cognitive schemas, influence how individuals interpret their experiences. These factors can lead to cognitive errors, which are logical distortion in the thinking process. Such errors cause people to interpret life events as a negative way. As a result, individuals tend to develop automatic thoughts. Unlike carefully reasoned judgment, automatic thoughts occur very quickly and often pass through consciousness without deliberate reflection. Because they arise so rapidly, people are unaware of these thoughts, instead only recognize the emotional consequences such as feelings of sadness or depression. However, it is important to note that with training and focused attention, automatic thoughts can be brought into awareness. Ultimately, these distorted automatic thoughts contribute to the development of psychological symptoms such as anxiety or depression. As we have just seen, distorted automatic thoughts play a major role in how psychological symptoms emerge, but these automatic thoughts don't simply appear out of nowhere. They are often guided by deeper, more fundamental patterns of thinking, which we call dysfunctional schemas. These are the underlying cause of cognitive errors and are sometimes referred to as a cognitive vulnerability. They are usually formed through early life experiences and later become activated when we encounter negative life events. Dysfunctional schemas are made up of certain maladaptive beliefs. These include broader generalization or rigid principles about life. For example, they often have absolutistic and dogmatic and idealistic and perfectionistic content. A common example would be my self-worth depends on others' evaluation of me. We can also understand these functional schemas through specific interaction model. For instance, people who have strong need for social affiliation may become especially sensitive to interpersonal events such as bereavement, divorce, or rejection. On the other hand, individuals with strong need for autonomy may feel especially vulnerable to events that threaten their independence or goal-directed behavior, things like job loss, illness, or poor work performance. In both cases, the dysfunctional schema makes these life events feel highly significant and can trigger strong negative thinking patterns. Now let's talk about cognitive errors. These are logical mistakes in the way people think, which make them interpret life events in an overly negative way. For example, one very common error is dichotomous thinking, also known as black and white thinking. This is when someone sees things as either all good or all bad, with no middle ground. For instance, if they make one mistake, they might think, I'm a totally failure. Another common one is overgeneralization. This happens when a person takes one negative experience and assumes it applies to everything. For example, failing one exam might lead to them think I'm going to fail in life. There are other types as well: mental filtering, magnification or minimization, emotional reasoning, and personalization. I won't go through all of them here, but I like to take a moment to read thoroughly the list on this slide and think of examples from daily life where you may have noticed these kinds of errors. Now let's look at the cognitive content specificity hypothesis. This idea suggests that the themes of automatic thoughts differ depending on the types of psychological disorder. In other words, each disorder has a characteristic style of thinking. For example, depression, people often have negative views about themselves, future, and environment. In contrast, hypomania, we see the opposite, an overly positive way of self, future, and environment. Another example is obsessive compulsive disorder, where individuals frequently experience repetitive warnings or doubt about safety. There are also many other conditions listed here, such as anxiety, phobia, eating disorders, and even hypochondriasis. I won't go through each one in detail now, but I encourage you to read the table carefully because it nicely summarizes how different disorders are linked to different patterns of thought. We have just seen how distorted automatic thoughts and dysfunctional schemas contribute to the development of psychological symptoms such as anxiety and depression. Building on this understanding, cognitive therapy was developed as a way to directly address these distorted thinking patterns. The main goal of cognitive therapy is replace maladaptive cognitive appraisals with more adaptive one. This is achieved through realistic, rational, and utility-based evaluation. One important method is the exploration of automatic thinking. Patients are encouraged to monitor their automatic thoughts using a daily thought record. By writing them, their thoughts, they can begin to recognize patterns that often go unnoticed. Another key component is the explanation of dysfunctional beliefs. Here, therapists help individuals identify recurring themes within their automatic thoughts, which uncover core beliefs about their life. A well-known tool for this is the dysfunctional attitude scale. Through these methods, cognitive therapy aims to restructure distorted thinking and in turn alleviate psychological distress. As you wrap up the cognitive perspective, it is important to recognize both its limitations and contributions. On one hand, Cognitive therapy sometimes places too much emphasis on the thinking process, overlooking other influences such as environment or past experiences. It also may not be as effective for individuals with limited introspective abilities or severe psychotic symptoms. On the other hand, its strengths are clear. Cognitive therapy provides a scientifically validated framework, offering effective treatment strategies that are both time efficient and widely applicable. It has become one of the most practical and influential approaches in modern psychotherapy. In sum, while cognition may not explain everything, the cognitive perspective has given us powerful tools to understand and treat psychological disorder, and it continues to shape the way we approach mental health today. Now, let's move on to the fifth perspective in understanding mental disorder, the neurobiological approach. From this point of view, psychological disorders are believed to arise from physical abnormalities in the body, such as infections or physiological change. In other words, the root cause of mental illness is considered to be biological, and therefore medical intervention is required for treatment. This perspective gained significant attention in the late 19th century when it was covered that general paralysis, 진행성 마비, showing a severe mental deterioration, was actually caused by syphilis, 매독균. This breakthrough led researchers to wonder, could other mental disorders also have clear biological causes that we simply haven't identified yet? Today, research in neurochemistry and brain damage continues to develop rapidly. Within the neurobiological approach, the cause of mental disorders are generally divided into three categories: generics, brain damage, and neurotransmitter abnormalities. First, generic. This is usually studied through twins, family, and adoption studies. Disorders with high heritability include autism spectrum disorder and ADHD. Second, brain damage. Infections, substance use, or alcohol abuse can damage the brain and lead to abnormalities in thoughts, emotion, and behaviors. With modern imaging technologies such as CT, MRI, PET scans, researchers can identify scientific brain area associated with certain disorders. This remains an active and promising area of research. Third, neurotransmitters abnormalities. Neurotransmitters are chemical messengers that play a critical role in communication between neurons. More than 50 neurotransmitters have been identified, but 3 are especially important in relation to mental illness: norepinephrine, serotonin, and dopamine. Norepinephrine is released during stress or emergencies and is thought to be related to panic disorder. And serotonin, which many of you may be familiar with, regulate mood, appetite, and aggression. Dopamine has been strongly linked to schizophrenia. Dopamine is also central to our brain's reward system, which drives motivation, pleasure seeking, and even addictive behaviors. Now that we have seen how biological factors can contribute to mental disorders, let us turn to the treatment developed within the biological approach. There are three main types of treatment we will discuss: drug therapy, electroconvulsive therapy, and psychosurgery. First, drug therapy. As we mentioned earlier, neurotransmitters play a crucial role in psychological disorder. Drug treatment work by regulating these neurotransmitters. For example, selective serotonin reuptake inhibitor SSRI are widely used for depression and pathological anxiety. Research has shown that this medication can be effective, and many drugs have been developed based on this principle. Second, electroconvulsive therapy, ECT. This method may sound unfamiliar or even intimidating. ECT is primarily used for treatment-resistant cases of severe disorders such as schizophrenia, major depression, or obsessive-compulsive disorders, where neither drug nor psychotherapy have been effective. In some cases, patients show dramatic improvement through ECT. Third, psychosurgery. Similar to ECT, psychosurgery is considered a last resort option for severe treatment-resistant mental illness. Historically, it faced criticism due to its side effects and ethical concerns. Like ECT, it is now performed only rarely and under strict medical conditions. Now let's take a look at the limitation and implication of neurobiological approach. First, the limitation. It's very difficult to establish neurobiological abnormalities as the definitive cause of psychological disorders. At best, they are correlational. Another limitation is the risk of overemphasizing pharmacological intervention while neglecting the importance of psychotherapy or counseling. There are also important ethical concerns, especially when it comes to invasive or irreversible treatment. Now, implications. Despite these limitations, the neurobiological perspective has made a significant contribution. In particular, it has played an important role in the development of stress-voluntary model of psychological disorder, which integrate biology, psychology, and social factors. We now come to the sixth and final perspective on psychological disorder, social cultural approach. Unlike the previous 5 approaches from psychoanalytic to neurobiological, They focus primarily on the individual. This perspective emphasizes how broader social and cultural context contribute the onset of mental disorders. After all, human beings are deeply social, and our psychological well-being is shaped by the environment we live in. Within this framework, we will consider three key viewpoints: the subcultural perspective, cross-cultural perspective, and social labeling theory. So far, we've talked about theories that explain mental disorders at the individual level, but there's also an argument that social and cultural environment play a major role. One example is the influence of subcultures. When we say subculture, we are referring to smaller group within a larger society, like rural and urban communities, or lower or higher social classes. These groups often live under very different conditions, and those conditions can shape mental disorder outcomes. There are two main hypotheses here. The first is sociogenic hypothesis, 사회 원인적 가설. This suggests that people in lower social classes face social neglect and fewer educational and economical opportunities, which increase their vulnerability to mental disorders. For example, studies show that schizophrenia tends to be more common in low-income urban population. In other words, social selection hypothesis, 사회 선택 가설, argues the opposite direction. It suggests that people with severe mental disorder may find it harder to function socially and economically, and as a result, they drift downward into lower social classes. It's difficult to say which explanation is completely correct. In reality, both processes may be happening at the same time. Building on this idea, let's take a closer look at how subcultures can contribute to mental disorders. The argument here is that certain social pathologies, such as gender discrimination or social inequality, can directly harm individuals' mental disorder. In other words, when society itself is sick, it is the individual who suffers. For example, the sociologist Thomas Szasz once emphasizes that in such a society, those who struggle to stay normal may end up being labeled with disorders like schizophrenia. This perspective highlights how deeply social conditions can shape our understanding, even the diagnosis, the mental illness. Another important factor to consider is urbanization. As a society shifts from rural to urban life, individuals often experience isolation, competition, and loss of traditional support systems. These pressures can contribute to the rise of mental health issues in rapidly developing cities. Psychologist Stanley Milgram even described his very first experience in New York City as overwhelming overstimulation. And statistics confirm this risk. Adult males in large cities are 38% more likely to develop schizophrenia compared to those living in mid-sized cities. Beyond urbanization, social instability also contributes to mental health challenges. Eric Fromm introduces the idea of marketing personality, describing how people adapt themselves to fit into the competitive market-driven culture. Similarly, Karin Hunay wrote about culture-bound neurosis, emphasizing how cultural pressures shape pathological distress. In highly competitive society, people are struggle with depression, feelings of defeat, and chronic anxiety, all of which can significantly undermine mental well-being. So here, urbanization and Fromm's perspective both highlight how large-scale social changes can have profound effect on individual mental health. Another important perspective is cross-cultural differences. If subcultural differences occur within the same society, cross-cultural differences compare cultures on a much broader scale, for example, between East and West, or between the United States and Europe. One study introduced in our textbook is Malinowski's anthropological research. He compared the Trobriand Islands with Western society. On Trobriand Islands, where sexual culture is more permissive and the father's role is absent, the rate of neurosis are relatively low. In contrast, Western society, which have shaped by the Industrial Revolution, competitiveness, achievement orientation, neurotic disorders are more prevalent. In addition, there are also culture-bound psychological disorders which appear only in specific culture context. For example, South Asia, there is Koro, a disorder where men believe their genitals are retracting into their body, often leading to panic and even death. Among indigenous people of South America, we found voodoo death, where breaking a taboo and receiving a curse from shaman can lead to death. In Korea, there is 화병, often described as anger syndrome. Another important factor to consider is social labeling theory. In many societies, there is a tendency to look down on people who express psychological difficulties. Receiving a psychiatric diagnosis is often hidden, and having a history of psychiatric hospitalization is even more difficult to talk about openly. This is what we call labeling, when society attaches a negative label to individuals with certain experiences. Once a person is labeled, it becomes very hard for them to reintegrate into society. Even after they recover, they may still be forced to live to the rest of their lives as they were merely a patient. I hope that as a society, we can move toward a more open and accepting attitude toward mental health conditions. Finally, Let's take a look at the limitation and significance of social cultural approach. From a social cultural perspective, social pathology are considered the root of problem. However, resolving these issues often requires a great deal of time and resource. Moreover, this approach does not offer many immediate interventions for those who are suffering right now. This is also some debate about whether such explanation can be regarded truly scientific. Nevertheless, we cannot ignore the fact that inadequate parenting styles or a destructive cultural environment can seriously damage our mental health. Therefore, we should never stop making effort to foster a healthy and supportive culture in our society. In this way, the socio-cultural approach has made an important contribution to social welfare and community well-being we live in. So today, we examine the major theoretical perspective on the causes of mental disorders. We discussed the psychodynamic, behavioral, cognitive, humanistic, biological, and sociocultural approaches. Each of these perspectives highlights different aspects of abnormal behavior, and together they provide a more complete picture of the complexity of mental disorders. Thank you for your listening.